Hi ladies, thank you for coming to my Women's Wellness Talk. My name is Noor, I'm a PA. I practice in the field of family medicine and I've been in this field for 6 years. I'm going to give you a few pearls today in regards to women's general health, and I hope that you can take some things that you might be able to implement into your daily lives. So let's get started. So how do we stay healthy? There are so many factors that we have to consider when it comes to living a healthy lifestyle, and diet and exercise are two major preventative steps that we can take in order to ensure that we're living that healthy lifestyle. So start reading the nutrition facts labels on your foods. You know, that becomes a really important skill to have because it's going to help you ensure that the kinds of nutrients that you're consuming are the appropriate nutrients your body needs to stay healthy and energized. Try to pick more foods that have the vitamin D, calcium, potassium, dietary fiber, and vitamin C. Try to choose less foods that have the saturated fats, sodium, and added sugars. Again, it's imperative that we talk about physical activity when it comes to living a healthy lifestyle. Make sure that you're getting at least 30 to 45 minutes of aerobic activity on a daily basis, along with muscle strengthening twice a week. Let's talk about sun protection. We want to prevent wrinkle formation and photoaging along with skin cancer. So what are the best ways for us to do this? We recommend wearing a daily SPF of 30 or higher. The best way to probably do this, to implement it into your daily regimen, would probably be to invest in a skin moisturizer that already has that SPF built into it. Make sure that it says broad spectrum to ensure that both UVA and UVB rays are both blocked. UVA rays will age the skin, whereas UVB rays will burn the skin, but both have the potential to cause skin cancer. It's important to note that UV rays are at their peak in the summer months from the hours of 10 a.m. to 4 p.m. And it's also very important for you to know that 80% of UV rays can still penetrate through clouds. So it's not only important that you're wearing your SPF when you're at the beach or at the pool, but also important that you're taking that preventative step in wearing it on a daily basis to prevent your skin from sun damage. Make sure you're staying hydrated and avoid smoking and tobacco products for your skin health. Let's talk about pregnancy. When it comes to preconception, you know, that aspect of your health will be addressed by your healthcare provider, but stay active. Make sure you're eating a healthy diet with fresh fruits and vegetables. The Mediterranean diet is extremely effective at maintaining a healthy lifestyle. Avoid alcohol, smoking, tobacco products. If you're thinking of getting pregnant, start taking a prenatal vitamin. If you've got chronic medical conditions, make sure that those are appropriately addressed and managed by your healthcare provider. While you're pregnant, go to your prenatal appointments. Get those tests done that your specialist is recommending for the safety of you and your baby. While you're preparing for your baby, go to those birthing classes, go to those breastfeeding and parenting classes. Those are so beneficial at alleviating a lot of that stress and anxiety and anticipation for what's to come. And after you've given birth, make sure that you and your baby's physical health are both at optimal status, but don't forget about mom's mental health. Keep following up with your clinician even after you've given birth to monitor yourself for any postpartum symptoms. Let's talk about menopause. Menopause is the decline in natural reproductive hormones. The average age of menopause is 51, but we typically see symptoms in our 40s. Perimenopause occurs 4 years before our final menstrual period. Risks associated with menopause are going to include accelerated bone loss and cardiovascular disease. The rationale for this is that estrogen is bone and cardioprotective. So as we are becoming estrogen deficient, we're becoming more at risk for osteoporosis and for the development of heart disease. It's also important to know that we tend to see an increase in cholesterol levels as we go through menopause. So that's another important issue to get screened for. And keep in mind, there are treatment options for postmenopausal symptoms. So those are things to discuss with your healthcare clinician if they're starting to affect your quality of life. And the last section is screening for women. So for breast cancer, get a clinical breast exam in your 20s and 30s and start an annual screening mammogram at age 40. That screening guideline can differ from female to female based off of her risk factors. For cervical cancer, start your PAPs at age 21. We'll continue those every 3 years, and then from 30 to 65, we'll continue a PAP every 3 years, or you can opt for a PAP cytology with an HPV test, which will change that screening parameter for you to every 5 years, and we usually stop those at age 65. For osteoporosis screenings, get your bone density scans after you've gone through menopause. Sometimes we recommend those starting at age 65. Again, that depends on your risk factors. And for colon cancer, start your colon cancer screenings at age 50. There's a couple of modalities that we can utilize now to screen for colon cancer, so discuss that with your clinician to see what's most appropriate for you. Make sure you talk with your clinician about getting screened for high blood pressure, diabetes, and high cholesterol. There's a lot of metabolic disorders your clinicians are going to want to screen you for. Staying healthy is a collaborative effort, so talk with your clinician. Make sure that you've got that open dialogue with them. I hope you guys are staying safe and well, and contact me if there's anything that you'd like me to elaborate on. Have a good one. Bye-bye.